Hi, this is Dr. Greg Grillo with Express Dentist. Sometimes I've been asked by my patients and by my friends, what does it take to become a dentist? And what are the qualifications of a dentist? Well, dentistry, the training for dentistry is a little bit of a long road. Most dentists go to dental school after they've done an undergraduate training. And the undergraduate training is generally a bachelor's degree, a 4-year degree, and it can be in just about any subject, but it must meet the pre-dentistry requirements. That means a lot of chemistry, organic and inorganic, physics, math, biology, zoology, different types of classes that would lend itself to healthcare. So if you can take all of those credits and meet them, then you can also get another degree. For example, I was able to do my pre-dentistry requirements, but I was able to get a bachelor's in psychology because psychology was very interesting to me. And dentists work with people, of course, and their feelings, and trying to understand that better just seemed like a good balance for me with all of the other sciences. So once you have that bachelor's degree, then you also take a pre-admission test. It's called the DAT, the Dental Aptitude Test. What's interesting about the DAT in the United States is that it tends to have an academic portion, of course, but also has a perceptual ability portion, which is very unique. And what that's really looking at is your ability to look at things, for example, in a mirror and operate in reverse, because a lot of times we're looking down into a mirror, but we're operating a handpiece up inside a tooth. And so the images are reversed. And so you might move to the right, but in the mirror, it looks like it's going to the left. So it's a very important test to measure your perceptual ability, because you can be very intelligent, but you may not be able to, your mind might not work that way. And it's very important, obviously, for a dentist. So when you apply for dental school, then they're looking at your undergraduate grades. They're also looking at your DAT scores, and they're looking at your interview, your experiences, your volunteer activities as well. Then dental school is generally 4 years in most schools. That may include summer quarters. These are very full quarters or semesters to meet all the requirements, which include a lot of advanced science, including gross anatomy and biochemistry and those types of classes. But then, of course, there's dental specific classes that you start to take for all the different dental procedures that we do. And from usually the first year on, after that first year with heavy sciences, you're taking more of those dental classes and getting into the clinical operations. So you actually start seeing patients at some point, and you become very heavily clinically focused, especially in the second half of dental school. And you have a number of requirements that you must meet and do different procedures in order to get through that 4-year program. Now, once you have been awarded that degree, the Doctor of Dental Surgery, or the DMD, it's DDS or DMD, there's 2 different degrees in the United States that can be earned. They both basically mean the same thing. They're issued by different institutions. And once you have earned that, you have to take a national board exam, which is a written exam. And then you have to have a licensing exam that you pass, which is primarily a practical exam. So in this case, for example, if you want to be licensed in the northern region, northwest region, you would take boards that are part of the Western Regional Board, and it involves doing procedures on patients and having each step of those procedures evaluated by the examining committee. And if you pass that, then you can apply for licensure in your state. And that may be transportable into other states depending on the area. But after that, to renew your license, you have to have a certain number of continuing education credits every year. And in some places, it may be every 3 years, a cumulative number. For example, in Washington State, you have to have 60 hours of continuing education every 3 years to renew your license. So that's the basic background that would apply to dentists in the United States. In general, it can be a little different depending on each state and each region, but that would be, most of the dentists that you see would have a background that's similar to that. So I'm Dr. Greg Grela with Express Dentist, and at Express Dentist, we have a trusted network of licensed dentists that you can call, and we can help get you referred to one in your area that you can get connected with and get the care that you need and deserve. So with that, take care and take care of your smile.